Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases like severe pneumonia. SARS coronavirus 2 or novel coronavirus is a new strain of coronavirus that was first identified in Wuhan of China, which causes the coronavirus disease which is now known as Covid-19. The World Health Organization recently declared the novel coronavirus outbreak a pandemic, a global outbreak of disease. Thus far, this novel coronavirus has infected more than 150,000 people in more than 150 countries all over the world.
While animals are the original sources of the virus, it is now spreading from person to person. If a person comes in close contact with an infected person who coughs or sneezes or touches objects or surfaces such as door handles or tables, contaminated from a cough or sneeze from an infected person, and then touches his or her mouth or face, that person can be infected with the coronavirus.
Reported illness have ranged from mild symptoms to severe illness and death. Symptoms may appear within highest 14 days after exposure. And symptoms include fever, cough, sore throat, fatigue, and difficult breathing. About 80% people who are infected may not get sick at all, or will get mild symptoms from which they will recover easily without getting hospital admission. 15% may require hospitalization, and only 5% will become severely ill and require management such as ventilator. Elderly people and those with underlying health conditions such as diabetes, cardiovascular disease, chronic respiratory diseases, and cancer are considered to be more at risk of developing severe symptoms. The present data show that disease in children and young people appears to be relatively mild. Unfortunately, there is currently no vaccine to prevent coronavirus disease. So, the best way to prevent illness is to avoid being exposed to this virus.
Take steps to protect yourself and your close person. Wash your hands often with hand sanitizer or with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing or sneezing. To wash your hands, wet your hands with clean running water and apply soap. If you are using sanitizer, apply a palmful of the product in a cupped hand, covering all surfaces. Rub your hands palm to palm. Rub back of your hands with interlaced fingers. Rub palm to palm with fingers interlaced. Rub backs of fingers with fingers interlocked. Rub rotationally each thumb. Rub tip of fingers in a circular motion. Rub your wrist. Rinse your hands. Avoid touching your eyes, nose and mouth with unwashed hands.
Avoid close contact with people who are sick. Keep distance of at least 1 meter or 3 feet between yourself and other people. Avoid social gathering. Avoid handshaking, hugging, and other social contact. Do not invite any unessential guests, including consultants and donors, to the office. Avoid traveling to other countries. ICDDRB has banned all overseas travel. Also, the government of Bangladesh has put restriction in overseas visit. Clean and disinfect touched surfaces frequently. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If you need to call a meeting, do not arrange any meeting or training with more than 30 people. Do not arrange any back-to-back meeting within a 45-minute gap. During this gap, you should clean the entire room, including furniture and microphone. ICDDRB has suspended its daycare facilities. Do not bring your kids to office. If you are a parent, you can choose to work from home. If you are above 60 years of age, you are highly encouraged to work from home.
If you have fever, cough, sneezing or respiratory distress, do not come to office. Stay home and contact the staff clinic and your supervisor for advice over phone. The emergency number of staff clinic are 01713 062 115, 01730 796 399, 01755 512 536, 01755 521 213, 01755 558 752, 01755 582 396. Clean your hands often. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in a closed bin. Immediately wash your hands. Wear a mask if you are sick. Remember, masks cannot protect you against coronavirus when used alone. When you use them, you must combine them with hand hygiene and other protective measures. If you have cough, fever, or difficulty breathing, you should wear a mask and seek medical care. If you are not sick, you do not need to wear a mask because there is no evidence that they protect people who are not sick. However, if you are healthy and taking care of a person who is infected with coronavirus, you should wear a mask whenever you are in the same room with that person. If you want to wear a mask, it is very important to wear and discard it correctly. To wear it correctly, you should locate the metal strip at the top of the mask. Place it over your nose bridge. Secure the elastic around your ears. Make sure it covers your nose, mouth, and chin. While in use, do not touch the front of your mask. To remove the mask, take the elastics from around your ears. Do not touch the front of the mask as it may be contaminated. Remove the mask and discard it in a closed bin. Clean your hand with alcohol hand rub or soap and water. Hand hygiene should be done if you accidentally touch the front of your mask. If your mask becomes damp or humid, replace it with a new dry mask. Never reuse single-use masks and discard them immediately after each use. Stay away from others. As much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom if available. Avoid sharing personal household items like dishes, drinking glasses, cups, eating utensils, towels or bedding with other people or pets in your home, and after using these items, wash them thoroughly with soap and water. Do not go to public areas like office, school, and do not use public transportation like public bus, ride sharing, or taxis. Seek prompt medical attention if your illness is worsening, for example, if you experience difficulty breathing. Stay at home until instructed to leave explicitly by your doctor. If you stay at home because of illness, you must be symptom-free for 2 consecutive days before returning to work. Moreover, if you have tested positive for coronavirus, you must also have at least 2 negative tests for coronavirus on 2 consecutive days before returning to work. ICDDRB prioritizes the health of its staff above all. Following some specific preventive measures can protect you, your dear ones, and your colleagues from the COVID-19.